Good afternoon and welcome, and thank you for joining us today for the meeting of the New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. Please note for the record, Karen St. Hilaire is representing Molly Wassow Park in a voting capacity.
Yes.
And I would like to first propose a motion to adopt the minutes of the Capital Committee meeting held on June 10th, 2024. I will poll the members. Dr. Katz?
Yes.
Sally Hernandez Pinheiro? Karen St. Hilaire?
Yes.
And I vote yes, the motion is adopted. So first we'll hear the report from the Vice President, Mr. Sayed.
Thank you. Good morning. All of our FY24 commitments have been finalized, and we continue to review our planned commitments for FY25 to ensure that we are on track to meet our FY25 budget. This month, we are bringing our final maternal health project funded by Brooklyn Borough President. I want to express our sincere gratitude to Brooklyn Borough President Reynoso for supporting us in this important endeavor. We just finished the second year of our ACE mentorship program. We had a great second group of high school students who were able to learn about planning, design, budgeting, construction, and sustainability elements of healthcare construction projects from a health and hospitals point of view. We completed our climate resiliency plan, a significant milestone towards our commitment to ensure the resiliency of the healthcare system's infrastructure in the face of climate change. New York City Health and Hospitals Harlem, we recently completed emergency work on the roof of Harlem's Central Sterile area because of a leak. Our teams quickly responded to ensure that there were no impacts to service. Also at Harlem, the condenser riser project was also completed. New York City Health and Hospitals Elmhurst operating rooms 11 and 12 have been reopened and are active in providing services to the community. New York City Health and Hospitals South Brooklyn Health, the new wellness room, has opened up for staff use. And finally, we have 4 items for the committee this month. NCB decanting for OTXHU, NCB boilers, King's Maternal Health, and Elmhurst lease agreement.
Any questions? No. I just 2 quick comments. Well, first, a lot of work, good work getting done, so congratulations. But the ACE mentorship program, how many kids do you get in that?
So last year we had about 12 consistently. This year we started with 14, kind of ended with a little less than a dozen, 6 or several. You know, attendance was a little tough, but the ones that stuck it through all
That's
the way.
great. It's a good program. I'm glad we're doing it. And then the climate resiliency plan, that is a public document that can be shared?
Yes.
Okay.
We will share. Thank you.
Terrific. Thank you. And Deborah?
Yeah, absolutely. Request for approval authorizing New York City Health and Hospitals Corporation, the system, to sign a 1-year extension lease with Elmhurst Associates, Inc., owner, for approximately 5,304 square feet in the first floor and basement of the property known as 7805 41st Avenue, Elmhurst, New York, the premises, which currently houses administrative staff of New York City Health and Hospitals Elmhurst, the facility, at the existing rental rate of $53.95 per square foot for a yearly cost of $286,151.
This is a space that Elmhurst has had since September of 2004. It's located right across the street from Elmhurst Hospital, roughly 5,300 square feet on the first floor and the basement. It currently houses our ACT program and our HR department. But with the opening of our Queens Boulevard site that's expected to open towards the end of next month, it gives us some flexibility here to consolidate some rental space and save the system some money. So when calculating both the rent and real estate taxes and utilities, we expect to save a little over $300,000 a year by consolidating this and bringing these services back onto either the main campus or the Queens Boulevard site. We are asking for an additional year extension just to work out the logistics of moving those departments back.
Great. So Elmhurst will continue to occupy a 5,304 square foot building at 7803, 7805, and 7807 41st Avenue in Elmhurst, New York 11373. This is a 1-year lease that will commence upon execution. The existing lease term will end on August 31st, 2024. It began in 2004 as a 10-year lease with 2 5-year option periods. The base rent for the 1-year lease is fair market value, $53.95 per square foot, which is $23,846 a month. Rent during the last 5-year option, years 16 through 20, increased by 2.75% per year, but will not increase in this additional year. The annual occupancy fee for base rent over a 1-year term will be $286,151. Request for approval.
Okay. Any questions?
Quick question. The ACT program, I know Elmhurst is so tight on space. You intend to move ACT back. Will they have the capacity to function as efficiently as they're functioning in the current space?
So as we begin to move administrative space, back office functions over to Queens Boulevard, it's going to free up space in the main campus where we can accommodate the ACT program.
Okay, thank you.
Any other questions? Great. Sounds good to be consolidating the space and a good extension. So I will ask for a motion to approve the resolution.
So moved.
And all those in favor?
Yes.
Any opposed? Great. The resolution is adopted for consideration by the full board.
Thank you.
Thank you. The next resolution, Manny?
Authorizing New York City Health and Hospitals Corporation to execute a contract with Sweet Group New York LLC, the contractor, to undertake decanting of New York City Health and Hospitals North Central Bronx as a part of the Correctional Health Services, CHS, Outposted Therapeutic Housing Units, OTXHU, for a contract amount of $12,069,614 with a 10% contingency of $1,206,961 to bring the total contract cost to not exceed $13,276,575. Okay, just a little bit on the background here. On March 4th, 2024, the mayor directed New York City Health and Hospitals to move forward with the construction of OTXHU at Woodhall and North Central Bronx. The North Central Bronx program will be located on the 13th, 14th, and 15th, 16th floors. The 13th floor will be partial. The anticipated completion date is 2027, pending timely finalization of the design. The first prerequisite phase is the renovation of the space on the other floors at the hospital and to accommodate the relocation of current staff from the 13th and 14th floors if necessary. This phase would allow for the hospital departments to move efficiently, occupy upgrades and updated spaces while allowing the construction of OTXHU to commence. And with that, I'll hand that over to Oscar.
Thank you, Manny. Good morning, Dr. Katz, Rita, Sally, board members. So the plans for the renovation and relocation were completed on April 8th of this year. It's a little bit complicated with the phasing plan, but essentially we're renovating the floors on B1, 3, 4, 6, and 13C to create a more efficient and upgraded space for which staff will be relocated from the 13th and 14th floor. So they're going to come down once those spaces are completed. The specific programs that are going to get impacted are medical records, patients transport, occupational therapy, and administrative offices that will be temporarily relocated from B1, 3, 4, and 13C over to the vacant floors 15 and 16 until the renovation is completed. At 13th floor, EITS, Metro Plus, and Hospital Police offices who will be relocated to B1, 3, 4, and 13C. And on the 14th floor, Nursing Administration and Training will be relocated to the 6th floor. In addition to that, there's going to be electrical, plumbing, heating, and ventilation and air conditioning work that's going to be included. In addition to that, installation of new IT closets. Next slide will show you the current pictures and the future state. There you go. So as you can see, it's a little bit dated, but hopefully once the work is completed, it looks a little bit more modernized and a little bit more efficient. Overview of the procurement. We advertised this on City Record. We had several walkthroughs or site tours to the bidders. Total of 13 bidders or contractors attended. We ended up receiving 7 bids on June 12th, and it was determined that Sweet Group was the lowest responsive and responsible bidder. Next slide will show you the contract amount for $12 million. Sweet Group currently has several contracts with us. They are doing the forensics new patient care unit at Bellevue, 19 East. They're also doing work at Queens Hospital on the N building, 4th floor, behavioral health space. Both projects they've been doing great on. They have an excellent rating. And we recently awarded the Woodhall Labor and Delivery Design Build project to them. And we've been working really, really well thus so far. The schedule, we're looking to begin this fall, 2024, and completing by spring of 2025. And Sweet Group has submitted a 30% utilization plan, and that's a list of their subcontractors that they'll be working with. The performance evaluation questionnaire yielded an excellent rating. Do the project budget, construction 12 million, contingency 10% at 1.2 million, total of $13.3 million. And the CP is currently approved by OMB as well. And the last is the resolution. We will take any questions you may have.
Any questions?
I'm just confused on the floor, but I'll just have to map it out. You know. Thank you, though.
Yeah, there's a lot of
Yeah,
shifting and changing, right? So we have the 13th, 14th, 15th, 16th floor. That space has to be cleared out, but before it gets cleared out, before they go somewhere else,
Right.
for lack of a better word, we have to renovate those other locations. So that's really what we're doing. We're renovating the other location. That way they can decant from those floors into those spaces, freeze up 13th, 14th, and 15th, and then we'll come back to the board when we're ready to implement the OTXHU
What's the
program.
square footage of the space that's being renovated?
For Suite Group?
Yeah.
Yes.
I do not
I'm just
have
cu-
that.
It's $12 million. I have no idea if that's a lot of money or little money.
Yep.
But I don't know how much space is involved or anything. So.
We thought it was a reasonable amount, but
Okay.
I will get you the square footage of
Okay,
the
thank
overall
you.
space.
It is a considerable amount of space, so go
Oh.
for it.
Okay.
And this is the beginning of, I'm sorry, Sally, were you,
No, I'm done.
the NCB OTXH?
Right, this is a prerequisite. We have to do this work first in order to allow the larger program to be implemented.
Okay. And this is included in the budget for the NCB?
This is included in the budget, correct. This all comes out of the CHS DOC budget that was allocated for the overall program.
Right. And the 15th and 16th floors, because there are some of this, some of the units that we're going to be relocating are already in the space that you're renovating, right? So they have a place to go in the.
Yeah, everybody has to go somewhere else.
Okay. All right. So it sounds a little complicated.
It is. It's a lot of moving parts, but yes.
I mean, the outpost units eventually will be on the part of the 13th floor, 14, 15, and 16. Currently, 13 and 14 are occupied. And they'll be moving to the lower floors, but there are programs already on those lower floors. So they're going to swing up. We're going to renovate those 5 floors at the lower, and everybody moves down. And the top floors are ready for outposted.
Got it.
Did that help?
Thank you.
Okay, great, thank you. And you can, so outposted is not expected to begin until this is completed, is that?
So this is the first of a few phases at NCB. This is the first one. Then there's some renovation, significant renovation that we'll be coming back to you for about the first floor. And Chris Mastromanno is here. This is something, with the outposted units are in hospitals where there has been underutilized space. The benefit to the hospitals obviously is upgrades, infrastructure, not obviously, but part of the idea here is to fortify and strengthen the hospitals themselves, so they get some benefits in terms of space utilization and some infrastructure, HVAC, stuff like that.
Right.
So the second phase of outposted will be probably the most visible for the hospital. That's really the ground floor. And then the third is actually the outposted units themselves.
Okay. Right, so getting some infrastructure work done here too
Yeah.
that's needed at the hospital. Great. Thank you. No other questions or comments? I propose a motion to approve the resolution.
So moved.
Great, and all those in favor?
Aye.
Any opposed? So the resolution is adopted. Thank you.
Thank you.
Okay. Authorizing New York City Health and Hospitals Corporation to execute a design-build contract with LF Gerstle Healthcare to undertake a renovation of the Women's Health, Labor, and Birthing Unit at New York City Health and Hospitals, Kings County, for a contract amount of $38,630,954, with a 10% contingency of $3,863,095 to bring the total cost not to exceed to $42,494,049. And with that, I'll hand it over to Jeffrey, our capital lead at King's Hospital.
Good afternoon, Dr. Katz, board members. Currently, the labor and birth-in program at Kings County occupies 23,000 square feet on the 5th floor. We received funding from Borough President Reynoso for an expansion of the birth-in center at this hospital. This request is for expansion of the space to increase, add 4 new birth-in centers, renovation of the existing 23,000 square feet, which would include renovation of the existing labor and birthing suites, all the triage rooms, addition of new recovery rooms in this particular space. We intend to modernize and upgrade the existing program space as needed to meet all new FGI qualifications and improve the patient experience throughout the birthing process. We will redesign the existing operating rooms and add an additional operating room to this particular space. We'll also create additional nursing stations along with necessary staffing requirements that are needed for this particular space. Thank you.
So in a nutshell, creating a brand new labor and birthing suite so that it can be patient and family focused. As Jeffrey said, modernizing the ORs, adding an additional OR, upgrading the L&Ds, new reception and nursing station, birthing showers, creating a new green space to support families, new recovery rooms, additional triage, new birthing rooms. This is a major project where we're expanding the building. This is not just working within our footprint, but actually having a building expansion out at the ES building. So it's going to add a lot of square footage for us and be able to increase the size of our program. And that'll show you in the next slide. It'll show you, there you go. In orange, that's where the expansion is going to go. So that's where the additional program will live, basically. So this is being done through design build. So there's an RFQ and an RFP criteria. The minimum criteria that was set was for design build services to have 5 similar projects, all over $10 million, preferred with healthcare and clinical experience, that they've worked with the City of New York before, and that they can hold a MWB utilization plan. So it's a 2-step process required by the state. The first one is RFQ, where we focus mainly on the firm experience and the staff experience. And then at the same time, while we were doing the RFQ, we're finishing out the design build documents, the bridging documents, completed the bridging documents and attached them to the RFP, which we provided to only the top firms that we shortlisted. As far as the RFP, we pivoted a little bit and wanted to focus a little bit more on the price. We knew that this was going to be expensive, so we wanted to really drive down the cost here. So we are our scoring weighing average was heavier on the price than on the actual methodology and scope of the work. Right there you have the list of committee members that participated. In addition to that, we had Dr. Wendy Wilcox from our central office, who also participated in the committee and the evaluations. Quick overview on the procurement, posted on City Record. We had also invited 26 vendors. 28 vendors attended our pre-proposal conference, and out of those 28, we received 11 SOQs, Statement of Qualifications. There was a final RFQ scores, and we selected up to 5 vendors in February. And the RFP, along with the bridging documents, were released to those top 5 vendors. We had walkthroughs in March. We received 4 proposals, 4 out of the 5 proposals in April. And we had presentations with all those 4 vendors as well in April. In May, we had a final round of Q&A with those vendors, and then we debriefed and submitted a final score, yielding Driscoll to be the highest rated proposer. And want to note that one of the reasons why Driscoll was one of the highest rated proposers is even though we did not outline it in the criteria as far as their experience, they did provide a lot of experience when it came to their labor and birthing. They teamed up with Gensler, and they've worked on labor and birthing at Presbyterian, Mount Sinai, Northwell, as well as other out-of-state systems. So they do have that particular experience, which was it really went over well with the committee. Contract amount, $38.6 million. Work is expected to begin winter 2024 with a 3-year initial term and 2 one-year renewal option. As I mentioned, they do have relevant work. This is the ones that were highlighted for this presentation, but they have a slew of other projects directly related to labor and birthing. They have committed to a 30% utilization plan, and there's a list of subcontractors that we'll be working with. The next slide shows you the project budget. Design build, $38.6 million. Contingency 10% at $3.86 million. Total of $42.5 million, which is all under budget. CP is currently pending at OMB, and we will continue to negotiate with the firm to try and drive down the cost even more, all the way up to the point of when we're ready to sign the contract and execute the contract. So this is more of a not to exceed amount. And as previously mentioned, we're very grateful for President Reynoso and his contributions to the budget. And with that, we'll take any questions.
Quick question. Yeah, 23,000 square feet plus some additional orange space that you're going to have about 1,300 patients. I guess it's a year coming in. You're going to build around the activity that goes on now. And in the center, you're not
You want to
closing.
Hi, so we've worked on an aggressive phasing plan to ensure that we can remain open while this construction ongoes. So our intent is to build the new section, the new birthing center first. And as we navigate through that part, keeping one operating room open at all times, and then we work essentially from the birthing centers to the LDRP rooms, then over to the triage rooms. So in essence, the clinic will be fully open, but we work on creative ways to make sure that we can hide and disguise the construction to minimize the look and maintain the look and feel that this is a hospital and a professional space. So at no time will anyone see that this is a construction area. It would just look walled off in certain areas while we renovate the existing clinic.
This is over a 5-year period, 3 + 1 + 1.
Well, that's the contract. How long do you expect?
So we anticipate this contract to be about 3 to 3.5 years for completion.
But in case it takes longer, there's 2 one-year extensions. Is that why? Okay.
We're building a little contingency within our
Right.
contract.
But you expect it to be done within
within 3 years.
less than 4? Yeah. Right. Okay. And then the orange space, I didn't understand. Is that there's nothing there and you're building?
There's a roof.
There's a
Right
roof.
now
Oh,
there's
so
a
you're
roof.
building above.
So we're building essentially above that roof. Is it on the 5th floor?
It's on the 5th floor.
So it's on the 5th floor. So that orange space right now is the roof of the 4th floor. So essentially, we're building out on top of that roof or above
Above it.
the 4th floor roof.
Okay. So complicated.
We don't like to keep things simple around here.
No, it's clearly not. But it sounds like it will be terrific once it's
It will, yeah.
And I think that was it. The CP pending, that is a process that just is a,
It's just formality. The contract is moving through in parallel, and we anticipate having the CP approved when we're ready for execution.
right, but you can't execute without.
Correct.
Okay, all right, thank you very much. So if no other questions or comments, I'd like to propose a motion to adopt the resolution.
So moved.
And all those in favor?
Aye.
Any opposed? No, so the resolution is passed for consideration by the board.
Thank you.
One more, right? Yeah, okay.
Okay, finally today, authorizing New York City Health and Hospitals Corporation to execute a contract with CDE Air Conditioning Corp. To undertake a boiler and BMS upgrade project at New York City Health and Hospitals North Central Bronx for a contract amount of $8,999,000 with a 15% project contingency of $1,349,850 to bring the total cost not to exceed $10,450,000 $348,850. A little bit on the background relative to this project. New York City, NCB currently has 5 existing boilers that serve the facility with steam for heating and sterilization. One of the existing boilers previously was completely taken out of service, which needs full refurbishment. Burners and controls 4 out of the 5 boilers are beyond their useful life and need significant upgrading. The existing facility has minimum means for heating, ventilation, and air conditioning. Sorry, a little tongue-tied with that today. HVAC systems, controls, and needs centralization building management system monitoring for operating and maintaining many crucial MEP systems. The BMS allows us to provide forward and technical controls where we can control various aspects of the systems remotely and through technology. Very much needed. And with that, I'll hand it over to Heba, who is our capital lead at Jacoby Medical Center
An NCB.
and NCB. Sorry.
Very important, an NCB.
NCB.
Just to give you an overview for the upcoming scope of work, we're doing new burners and controls for boilers 1, 2, 3, 4, and 5. Complete refurbishment of boiler number 4. That's the one that's completely out of service. New boiler burner management system. New building-wide BMS system to control all the mechanical equipments and future upgrades that are coming to NCB as well. The work is expected to be completed in phases, so that way we're not completely out of boilers and to continue the steam supply. Project is expected to begin this fall through spring of 2026 for an approximate duration of 18 months. The next slide. Okay, so an overview of the procurement on the 14th and the 15th of February, we had the site tour for the bidders. We had 16 contractors show up to the site walkthrough. The bid due dates were March 14th. 8 bids were received. On May 30th, we determined the lowest bidder. It was finalized to CDE Air Conditioning Inc., and they were the lowest and most responsive bidders. Again, the procurement was completed via public bid. The contract amount is $8,999,000. CDE is a mechanical HVAC contractor. Their ratings on MOX included 4 excellent, 7 good, and 4 satisfactory. Expecting the construction to begin in fall of 2024 or earlier, with a completion expected by spring 2026 for a total duration of 18 months. CDE has committed to a 35% MWBE subcontractor utilization plan is presented below. Their performance evaluation yielded a good on the previous slide. And again, requesting the project budget construction cost of $8,999,000, contingency of 15% of $1,349,850 for a total project cost of $10,348,850. The project CP is approved and the money has been allocated for this project. The last slide is the resolution. Questions if you guys have it.
Any,
I guess we had a 15% contingency here, and that's because the work scope is uncertain. And a related question, I didn't know if something could be at the end of its useful life, but then you could upgrade it to make it
can we do that with people?
usefully functional as opposed to replacing it.
So all of these boilers are over 25 years old at this point. They're definitely beyond their useful life.
Right.
We are doing upgrades. Only one of them is getting a complete refurbishment, and that's the one that's completely out of service.
Right.
15% contingencies, because once we open up the boilers and we inspect the burners, I'm sure we're going to be finding more work that needs to be completed to refurbish it.
And I guess replacing them all is just too expensive, is that?
Yeah.
Yeah.
when we say that it's beyond the useful life, that doesn't mean we're gonna stop using it.
Oh, there's
We have many things that are beyond their useful life that we continue to use, right? It's a statistic, right? It's a standard. It should go X years. And we have many things that have gone X plus Y years because we just don't have the ability, the dollars to prevent it. When I talk about our capital needs, this always comes to the top of the list, that we are lucky that we have political leaders who will help us with, new maternal services and cancer screening and other great programs. It's a lot harder to get dollars for boilers and HVACs and, it's just not an attractive thing to fund. And so we
But
have
very critical,
decaying,
yes.
yes, we have decaying infrastructure.
Right. And they work magic behind the scenes to
They
make
do.
sure it continues
They
to be safe.
duct tape.
Incredible
and-
teams.
Right.
Yeah, incredible teams that are very familiar with the building and the systems, and they really come together and make sure our systems are really operable. And while it's past its useful life, it's not the end of
Not
its life,
dangerous,
right?
right,
So,
yeah.
very important components can be replaced in a boiler as long as the shell can hold, and that's what we're doing in a lot of places.
And how long has the existing boiler been out? The one that has been out?
I believe about 4 years.
4
Yeah,
years.
3.5, 4 years.
Wow.
Yeah.
Right. Okay. Any other questions or comments? Seems very necessary. I'm glad the work's getting done and the dollars have been allocated. So do we have a motion to approve this resolution?
So moved.
Okay, all those in favor? Aye, great. No opposed, so the resolution is passed for consideration of the full board.
Thank you very much.
Thank you. Is there any old business? Any new business? There being no further discussion, meeting adjourned. Thank you.
Thank you.
Thanks for.
This meeting is no longer being recorded.